Hello and welcome to our channel, where we provide valuable information to help you improve your health and well-being. If you have recently undergone a knee replacement surgery or are planning to do so in the near future, this video is for you. Knee replacement surgery is a major procedure and it requires careful planning and preparation. However, even after the surgery, many people make mistakes that can slow down their recovery and even cause complications. In this video, we will discuss the top 5 mistakes people make after knee replacement surgery and how to avoid them. Mistake number 1. Not following the rehabilitation plan. One of the most important things you can do after knee replacement surgery is to follow your rehabilitation plan. Your doctor and physical therapist will create a plan that includes exercises and activities to help you recover and regain mobility. However, many people skip or neglect their rehabilitation plan, which can lead to slower recovery and even complications such as infection or blood clots. It's important to stick to your rehabilitation plan and to communicate with your healthcare team if you have any concerns or questions. Mistake number 2. Ignoring pain or swelling. After knee replacement surgery, it's normal to experience some pain and swelling. However, if you notice that your pain or swelling is getting worse or is not improving, it's important to speak with your doctor. Ignoring pain or swelling can indicate a problem with your recovery and can even lead to complications such as infection or blood clots. Your doctor can help you determine the cause of your pain or swelling and provide you with the appropriate treatment. Mistake number 3. Not taking care of the incision site. The incision site is where your surgeon made the cut to access your knee joint. It's important to take care of this site to prevent infection and promote healing. This includes keeping the incision site clean and dry, changing your dressings as directed, and watching for signs of infection such as redness, swelling, or discharge. If you notice any signs of infection, it's important to speak with your doctor right away. Mistake number 4. Overdoing it. After knee replacement surgery, it's important to rest and take it easy for a while. However, many people make the mistake of trying to do too much too soon. Overdoing it can lead to complications such as swelling, pain, or even damage to the new joint. It's important to follow your rehabilitation plan and to listen to your body. If you feel tired or in pain, it's okay to take a break and rest. Mistake number 5. Not taking care of your overall health. Your overall health can play a big role in your recovery after knee replacement surgery. It's important to eat a healthy diet, get enough rest, and avoid smoking or drinking alcohol. These factors can affect your immune system and your body's ability to heal. It's also important to take any medications as directed and to attend all follow-up appointments with your healthcare team. In conclusion, knee replacement surgery can be a life-changing procedure that can help you regain mobility and improve your quality of life. However, it's important to avoid the mistakes we discussed in this video in order to have a successful recovery. Remember to follow your rehabilitation plan, take care of your incision site, rest and avoid overdoing it, and take care of your overall health.